If you go back to your old habits, you're going to get the same results. So whether you do surgical liposuction or if you do laser fat reduction, if you don't address the underlying dysfunctions like a bad diet, an underactive thyroid, some blood sugar dysfunctions, once you're done, like with surgical liposuction, that actually removes the fat cells. And so you will never put fat on that area. But then if your diet is off or your thyroid's off, that's when you can start to put it on under the chin, or you can get these balloon arms. You can get this appearance, like they say, that looks kind of like the Michelin Man. With a laser, it doesn't destroy the cells. So what it actually does is it causes a temporary pore to open up in the fat cell, and the fat liquefies and moves out of that cell, and then it gets shuttled off into the lymphatic system where it gets broken down and burned as fuel. The lasers are FDA cleared, so the laser that I use is by Erconia. They were the first one to ever do studies and to get FDA clearance. And what they did is they took groups of patients and they did no other changes no diet changes or exercise changes, did the laser only. And in 6 sessions, the average fat reduction was between 3.5 inches to 6 inches, just from using the laser. And again, that's because it's going to cause that fat to liquefy and move out of the cell. So like in my office, what we do with patients is we have them do a 1-session challenge to where we'll measure them, and then we put them on the laser, and then we measure them right afterwards. And you can usually see at least 1/4 of an inch to 1/2 inch drop from the midsection during that time without any kind of side effects on there. The problem in the laser community is that we have this device that's a true laser, and the placebo that was used in the study to get FDA clearance was an LED device. And the LED device did have some results, but it was about 1/10 as effective as a true laser on there. So you do have some locations that will sell an LED device and call it laser, and you don't get as good of a result as you do with the actual laser on there. And there's no pain and no downtime with the lasers. But again, once you're done with that treatment protocol, you want to make sure that you're practicing a healthy lifestyle with exercise, with eating right, in order to maintain your changes.